In April 2017, the Indian Parliament passed the Mental Health Care Act. This new legislation superseded the previous Mental Health Act of 1987, creating a strict new legal vocabulary for the psychiatric care system. The law defines mental illness as a substantial disorder of thinking, mood, perception, or memory. This includes conditions that impair a person's judgment and their ability to recognize reality, though it explicitly excludes mental retardation from this category. Mental health care is also legally expanded here. It refers to the full process of analysis, diagnosis, and treatment, as well as the long-term care and rehabilitation of the patient. Any facility providing these services is classified as a mental health establishment. This definition covers every government hospital, private trust, and local clinic designed for the convalescence of people with mental illnesses. The Act also codifies the concept of independent patient admission. If an individual has the capacity to make their own choices or requires only minimal support to do so, they have the right to request their own admission for treatment. These specific legal definitions redirect the entire medical system toward providing patients with structured, right-space rehabilitation. Historically, under Section 309 of the Indian Penal Code, attempting suicide was a crime. Survivors could be punished with up to 1 year in prison, a fine, or both. The 2017 Act changes the baseline legal assumption. It now presumes that any person attempting suicide is acting under severe stress rather than criminal intent. Because of this presumption, the government is now legally mandated to provide treatment and rehabilitation aimed at reducing the risk of a recurrence. The law reclassifies extreme mental distress as a medical emergency, requiring the state to provide immediate help rather than a prison cell. To protect patient autonomy, the Act introduces the Advance Directive. This is a written document where a person dictates exactly how they wish to be treated for a mental illness if they lose the capacity to decide in the future. The patient can also appoint a nominated representative. This person is legally authorized to make healthcare decisions on the patient's behalf if a medical practitioner determines the patient currently lacks the capacity to choose for themselves. The law uses a strict three-part test to evaluate if a patient has the capacity to make decisions. First, they must demonstrate an ability to understand the information regarding their treatment or admission. Second, they must appreciate the consequences of that decision. Finally, they must be able to communicate their choice. If a patient meets these three criteria, their legal autonomy remains intact. This framework ensures that a psychiatric diagnosis does not automatically result in the loss of personal rights. Instead, decision-making capacity is systematically measured and protected. Patients also hold specific, legally guaranteed rights. These include total confidentiality, full access to information about their illness and side effects, and the right to medical insurance on the same basis as physical ailments. To protect privacy, the law forbids the release of any photograph or information relating to a patient's illness to the media without their explicit prior consent. Treatment is provided through a hierarchy of informed consent. Doctors must follow the patient's direct choice, their advance directive, or the decision of a nominated representative, which must be formally reviewed every 7 days. These protections reshape the relationship between doctor and patient, establishing the medical facility as a collaborative environment. To enforce these rights, the Act requires every mental health facility to register with the authority. It is illegal for any person or organization to run an establishment without this official certification. This chart shows the financial penalties for running an unregistered facility. A first offense triggers a fine of up to 50,000 rupees. A second violation raises that to 2 lakh rupees, and subsequent offenses can reach 5 lakh rupees. The law also carries mandatory prison time for those who contravene these regulations. A first offense results in a sentence of up to 6 months, while repeated violations lead to a 2-year prison term. Individual health professionals are also accountable. Anyone who knowingly works in an unregistered mental health establishment faces a personal fine of 25,000 rupees. These severe institutional consequences ensure that the rights granted to patients are enforced, not just suggested. Pacing quickens slightly. We also see strict regulation in the Transplantation of Human Organs Act, or THOA. This law governs the use of human organs for therapeutic purposes, defining an organ as any structured arrangement of tissues that the body cannot replicate if removed. There are two critical facts for medical exams. Donors must be at least 18 years old to authorize an organ removal, and bone marrow transplants are excluded from THOA's regulations. Finally, eyes and ears can be removed from a donor at any location by a registered practitioner. However, brainstem death tests must be performed by independent doctors, never by the transplant surgeons or their team. Both the Mental Healthcare Act and THOA rely on these rigid legal definitions to safeguard patients from institutional exploitation.